February 25th, 26. Good morning. Here is the day's top medical news for you. Breakthrough tech, the oxygen gel. The story, a new oxygen-delivering gel developed at UC Riverside could be the holy grail for diabetic wound care. The problem, chronic diabetic wounds often lead to amputations because oxygen can't reach deep tissue. The solution, this gel uses a tiny, battery-powered system to deliver a continuous flow of oxygen directly to the wound, potentially preventing thousands of amputations every year. Similarly, doctors at Narayana Health reported today that 95% of bone cancer cases no longer require limb amputation thanks to early diagnosis and improved limb salvage surgery. Oncology and rare disease updates. FDA approvals. Today, the FDA granted traditional approval to Braftovi, encorafenib, for adult patients with a specific type of metastatic colorectal cancer. Rare disease win. Johnson & Johnson has officially submitted nipocalimab for FDA approval. If passed, it will be the first-ever treatment for warm autoimmune hemolytic anemia, a rare condition where the body destroys its own red blood cells. Ultra-rare framework. The FDA also launched a new framework to speed up individualized therapies for children with ultra-rare diseases who can't wait for traditional randomized trials. The Health Tips segment, latest studies. Alzheimer's warning. New research suggests Alzheimer's may begin with a silent drop in brain blood flow and oxygen use, years before memory loss occurs. The sugar connection. A massive study found that people with restricted sugar intake during their first 1,000 days of life, from conception to age 2, had significantly lower rates of heart disease and diabetes as adults. Gut health. Intense overtraining may actually rewire your gut bacteria in ways that temporarily reduce immunity, proving that more isn't always better for athletes. Public health. In major policy news, the PMJ health cover has just been expanded to 5.5 lakh families in Delhi, specifically targeting widows and persons with disabilities. Neurology update. Today's neurology updates are packed with first-ever breakthroughs from a blood test that acts as an Alzheimer's countdown to a major shift in how the FDA approves new drugs. 1. The Alzheimer's clock, a single blood test predicts onset. The biggest headline today comes from a study involving over 900 participants, published in JAMA Neurology. Scientists have developed a blood test measuring a specific protein, p-tau217, that can predict exactly when an individual will start showing Alzheimer's symptoms. The breakthrough, this biomarker clock, isn't just about saying if you have the disease, but when it will arrive. It can estimate the age of symptom onset with a median error of only 3 to 4 years. Why it matters? This allows for a precision-tailored approach where doctors can start treatments years before the first memory slip occurs. 2. FDA shakeup, the one-study rule. Impact on neurology. This could shave years off the timeline for getting experimental dementia, Parkinson's, and MS drugs from the lab to the pharmacy. In a massive policy shift that dropped just hours ago, the U.S. Food and Drug Administration, FDA, is officially relaxing its decades-old requirement for 2 separate large-scale trials for new drugs. The news. For common diseases, the FDA's new default position is to require only 1 rigorous study to prove effectiveness. 3. New approvals. Rare diseases and Parkinson's tech. The FDA has been on a roll this week with several specialized approvals. Pediatric narcolepsy. Harmony Biosciences received the green light for Wakix, pitolisant, to treat cataplexy in children as young as 6. Arginase 1 deficiency. A new enzyme replacement therapy called Lorges was approved on February 23rd to treat this rare metabolic disorder that causes severe neurological decline. Coming soon, decisions are expected by the end of the week for idebenone, a treatment for Leber hereditary optic neuropathy, a rare form of vision loss, and tolebrutinib, which could be the first ever BTK inhibitor for non-relapsing secondary progressive MS. 4. Lifestyle medicine, dancing and DASH. 2 long-term studies released today provide fresh evidence that we can lifestyle our way to a younger brain. The Dance Defense, a 20-year study found that frequent dancing, at least once a week, is linked to a 76% lower risk of dementia. It's believed the combination of physical movement, social interaction, and cognitive effort creates a perfect storm for neuroprotection. Middle-age diet. New research confirms that following the DASH diet in middle age significantly lowers the risk of cognitive decline in later life. High intake of vegetables and fish showed the strongest correlation with brain health. 5. Lab breakthroughs, brain origami and rejuvenation. DMTF1 protein. Researchers have identified a protein called DMTF1 that can effectively reboot aging neural stem cells, restoring their ability to regenerate even after age-related damage has set in. Molecular barcodes. A stunning study from UCSF revealed brain origami, how DNA folds into unique, snowflake-like patterns to create a specific barcode for every single neuron. This could be the key to understanding why some people develop schizophrenia or autism. Rapid fire round. Quickly before we go. In tissue samples collected from patients with prostate cancer, microplastics and nanoplastics (MNPs) were present in almost everyone, according to a small proof-of-concept study. MedPage Today. Aspirin prophylaxis for preterm eclampsia. The Fetal Medicine Foundation (FMEF) method for early risk assessment and aspirin prophylaxis showed no significant reduction in preterm preeclampsia in a Swedish population-based study of 61,840 deliveries, with a tendency toward increased term preeclampsia rates noted. Medscape. Maternal diabetes mellitus, particularly type 2 and type 1, is associated with an increased epilepsy risk in offspring, a Canadian population study found. Medscape. That's your medical news update for today. Which of these updates do you think will have the biggest impact? Let us know in the comments below. Stay informed and stay healthy. Remember to consult a healthcare professional for any medical concerns. If you found this update helpful, hit that like button and subscribe for your regular medical briefing. Disclaimer: use the content after verification.